Mike just would live on the golf course if he could.
Well, I always loved playing golf. I guess one of the things I love about golf is the fact that no matter how hard you try and how long you practice, you're always going to have an opportunity to get better. I'm 70 years old, and I retired from the food industry where I worked for about 37 years. About 8 years ago, I retired. And my wife, Kathy, and I, we live in Wheaton, Illinois. Kathy and I were married in January of 1975. So she can tell you how many years that is.
I can remember when we were first married, realizing that I was going to have to play more golf if I was going to see him more.
In the summer of 2009, I was playing all the golf I could. And I started having a problem with my left wrist.
When Mike first found out something was going wrong, we were headed for a vacation at the lake with our college friends. And because his wrist was hurting, we stopped along the way to see a doctor that his brother had set up.
I was in intensive care, 3 different hospitals in 3 different states in the next 30 days.
When Mike was first diagnosed, I guess I transitioned from thinking, well, we get through this and then life will go back to normal, to accepting that this was the normal life and we had to figure out how to live it the best way we could, which meant if you woke up and it was a good day, you ran with it.
My name is Mike, and I have Waldenstrom's Macroglobulinemia.
So WM is a special type of lymphoma. It's very unique. WM lymphoma can produce a unique protein called monoclonal IgM protein. So back in 1944, Dr. Jan Waldenström, a Swedish physician, first described 2 patients with this condition. So later on, the disease is named after him. And then the second part of the name, the macroglobulinemia, is referring to the IgM production. Well, IgM being the biggest immunoglobulin molecule, that's why it's the macroglobulin. So overproduction of this macroglobulin is called macroglobulinemia.
So after I saw the hand specialist in Louisville and they discovered that my platelets were so low, they immediately put me in the hospital for treatment. We did a bone marrow biopsy and they saw some abnormal cells, and I started having some significant indications of disease progression. And sure enough, my platelets had plunged to a new low. I ended up in a intensive care unit, and I went to Northwestern. My brother Philip had arranged for me to see what he considered to be the best possible treatment option here in Chicago. With my blood work and the different issues that I had with the neutrophils dropping, and importantly, the IgM being elevated, over time they knew that the Waldenstrom's was my specific type of lymphoma. The prognosis was 3 to 8 years of expected life. That was a kind of a gut punch for all of us.
So in Mike's case, his body developed autoimmune antibodies that's attacking his own platelets. He noticed increased bruising on his arms. He actually was having some spontaneous risk of bleeding. And that's a result of the autoimmune attack.
My job before I retired was to head up our global accounts, which means I was traveling all over the world. And ultimately, I made the decision that it really wasn't something I could do going forward.
So we do know there are some genetic mutations that has been identified in Waldenstrom. One is a mutation in what's called MYD88 or MYD88 gene. So there's a particular mutation in this molecule that can make the molecule activate more of the downstream signaling that's causing the B cells, supporting the B cell survival and proliferation, which can contribute to the pathogenesis of Waldenstroms. About 20% of Waldenstrom patients do have a strong family history of either Waldenstrom itself or other type of lymphomas.
Hey, buddy. My parents both lived well into their 90s. No one in my family has ever had cancer. I'm the first. So I'm kind of a pioneer in that regard. But I'm very optimistic. I'm very positive. I did have symptoms from the chemotherapy. The side effects and the way it makes you feel, it's not great.
There was a part of me that said, well, we'll get through the chemotherapy and we'll get through this treatments and then we'll be okay. We'll be okay. And that just really didn't turn out to be the reality.
In September of 2020, I was approved for a relatively new drug, which is a Bruton kinase inhibitor. And this drug has completely stabilized my blood metrics. I have had no relapse at all. I feel much better than I did before on an ongoing basis. And we're going on almost 2 years now, and things have been very stable. So I feel very blessed. It's been a life-changing experience for me, and I couldn't be happier at this point.
It's been a miracle. The dramatic change in the way he felt, the red spots he had on his chest, that they disappeared. I mean, he had them for years. So this was a game changer.
Boy, it is a beautiful day, isn't it?
Yes.
In general, my health is very good. I see my oncologist every 3 months, and they do a complete blood work. And again, everything has been extremely stable for the last 2 years.
If a patient is diagnosed early, there's a benefit of then we can watch them more closely, and we know if they're starting to develop symptoms, we can start treatment to prevent the Waldenström-related complications. So it does give us the benefit of knowing the disease and taking preemptive action.
So I guess the original prognosis for 3 to 8 years is behind us now. And again, I feel very blessed. I realize that things could change tomorrow because they've changed so many times in the past. But this drug that I'm on, I take it twice a day. It's given me a lot of hope for the future.
So there's another class of targeted therapies that's also very promising that's in the horizon, which is a inhibitor for BCL2. It's also oral targeted therapy. So BCL2 is a protein that is protective for cancer cells. So that's a programmed cell death is called apoptosis. But there is a class of protein that can block this process. So this class of BCL2 inhibitor has already been currently FDA approved for some other related low-grade B-cell leukemia lymphomas. And now it has already been studied in Waldenström macroglobulinemia, and the preliminary studies are showing very promising results. So in Mike's case, for example, he was treated in the past, and then when the disease relapsed, we can still have other treatments that can manage the disease. So we can really control the disease for many years, and there are many new treatments coming up. We're very optimistic in being able to help patients to live a very long life.
Mike has relied on our families and immediate families and extended families and the friends that we have to provide him with the relief from what is at times a very challenging disease.
Rumpa-dumpa-da-da, rumpa-dumpa-doo, every day at Papa Mike.
They take his mind off the negative aspects of his life and just give him something to focus on that's just positive, makes you smile. There's nothing in the world like holding a sleeping baby or teaching a grandson how to play golf or doing the hamster dance with your granddaughter. All of those leave you with a smile on your face.
One of the things I love about golf is you learn to play one shot at a time. And because you can't do anything about the last shot and you can't do anything about the future shot, all you can do is play one shot at a time. I believe that dealing with this type of lymphoma is very similar because all you can deal with is the present. I don't think about the past a whole lot, and I try not to think about the future because, again, there's nothing I can do about that. As Bobby Jones said, you play the ball as it lies and you play one shot at a time.